All right, so in dealing with every disease condition, it's always good that you look at the classification of it. All right, so when you look at the classification of a disease condition, it helps you to now know how you can be able to stage that disease condition. Apart from staging, how you can be able to, yes, know the level at which the disease, that's still staging though. All right, then in the long run, it helps you to know which type of treatments you also employ, and all of that. All right, then later on, when you are treating the patient, it helps you to know if the patient is kind of like recovering. So there's a classification of heart failure in children, which is known as a ROS classification, modified ROS classification. So when they say modified, of course, it was initially done, later on they improved it. So this classification, let's introduce it, right? So it's a pediatric adaptation of New York Heart Association. It's designed to assess the severity of heart failure in infants and children. So unlike the adult focused New York Heart Association system, the modified ROS incorporates age-specific symptoms like feeding difficulties. Like, it focuses more on these children that we're actually focusing on this channel. All right, so let's pick this one up. So this is it. All right, so based on severity. Okay, so we look at the classes, we look at how it can affect infants, how it can affect older children too. So class 1, there's no symptoms or limitation in infants. All right, in older children too, no symptoms or limitation. Class 2, there's mild tachypnea, there's difficulties in breathing, right, and they are sweating as they feed. In older children, there's mild to moderate dyspnea on exertion. In old children, like, the symptoms are less because your body is much more developed to handle stress. But in children, as the stress comes, it shows up like that. Class 3, there's mild tachypnea or sweating during feeding. There's marked that word. Also in older children, there's marked dyspnea on exertion. So that means if they are resting, there's no issue. But if you ask them to do some daily activities that will strain their body, that's when you have the marked issues. Class 4, symptoms at rest. They're having difficulties in breathing, retractions, grunting, diaphoresis, growth failure. Okay? Older children, symptoms at rest. They are unable to carry out their physical activities. So key features is feeding difficulties are the major issues you see in children. All right, exercise intolerance is more relevant in older children. Do you understand? Because then their body could handle the stress if they are just resting. But when you now put them into activity also, you have it showing up. So growth failure is a critical sign across all ages. Okay, the classification helps to guide treatment intensity. All right, it will help you to know which stage this patient is at. It will help you to know which type of treatment you employ for this to the patient and all of that. Okay, so that was it for the modified ROS classification of the severity of heart failure in children.